Hello everyone, Dr. Mak with another video today. This video, I'm answering all your Q&A, the one you posted on Instagram, all your frequently asked questions about the ADC exam. I thought that'd be a good idea because there's so many questions keep coming every time on my Insta feed, on my Facebook page, and I thought it's a good idea to maybe do a new video every month or so. I did a last video about 10 frequently asked questions. It's already on my YouTube. If you haven't seen it, do watch it first. It might answer some of the queries that you already have about the ADC exams. But I've decided that I might do a new one every 2 months or so. So new questions coming in, previous ones coming in. We have a bit of a series of the ADC questions. So if new person's coming in, they don't have to worry too much and they're not getting too confused about certain things that nobody tells you. So we'll be answering your questions on a regular basis now. So this video, I'll be opening up my Insta feed and all those, I think 15, 20 questions that I have, I'll be answering that. So you all have an idea about, in my opinion, what is the answer for your questions. So let's get into it without wasting any time, yeah? So I'll be opening up just the feed here to get things going. So the first question is, and again, I'm not going to be taking names. So whoever asked this question, I'm not going to be taking names about the person who asked me this. But yeah, I'll just say the question and where it was from and answer from my point of view. So the first question is from someone from overseas. He's from India. And this is some of the questions that I have explained previously in my 10 frequently asked questions video as well. But a lot of people ask me this a lot. If you are a specialized dentist, and the question is that I am an orthodontist in my country with 25 years of experience. Now, if I want to work in Australia, what should I do? Like, do I have to go through the ADC again, or is there any specialist equivalency exam that I can do that and work as an orthodontist? Because I haven't done general dentistry in the past, say about 10 years, so I don't even remember. Unfortunately, ADC previously had a dentist exam and a license exam. Now they have reduced that or stopped doing that. Previously, we have a specialist exam and a general dentist exam. Now we have only a general dentist exam. So what ADC is basically telling you that even if you're a specialist in your country with 100 years of experience or with no experience, it does not matter. You have to go through the same process. Previously, they had a specialist exam. So if you're a periodontist or an orthodontist or an oral surgeon, you can do the specialist exam and then practice your specialization in Australia. Now what they're saying is, it does not matter how much skill level, how much experience, and how many degrees or specialization you have. You'll have to go through the same process. First, you get yourself registered as a general dentist. From there, you go and do whatever. But ADC is your answer. So even if you're a specialist or a general dentist, you have to go through the same process. So I get a lot that, I'm an orthodontist or an oral surgeon. I have this much experience. What can I do? Unfortunately, you're in the same boat as the rest of us. You have to do the ADC exams and then follow it through. Now, the second question is from a person who asks me that what are the ways to practice dentistry in Australia? Like, is ADC the only option? Now, you can do something called as a declindent, which is like in England, you have MClindent, right? Like a specialization, a 3 years clinical specialization. The problem with that is to get into declindent, as far as I'm aware, I've checked it, you can double check it. To enter the program, you need to pass the ADC Part 1 written exam. Without that, you can't enter. And to get the written exam, again, you have to get your registration first, right? So basically, you're doing the part 1 of ADC, which is the registration. Then you're doing the part 2, which is the written. Then you enter the declined program. You work 3 years, you study, you get that clinical degree. But there are two things that you need to be aware of. One thing is, after doing that clinical masters or the specialization, can I work as a specialist in Australia or not? Number two, what's the cost involved? Because cost is the issue for everybody, isn't it? So the answer for this is cost-wise, and again, as I say, that's what my knowledge is, but you can always double check these things, everything's on the website of the universities and stuff. For declined, it's around $60,000 to $80,000 per year. So it's 3 years clinical degree. So you're multiplying that by 3. So you're looking at, say, about 180 to 220, like 200,000 if I get an average. That's just your tuition fees. You don't get paid during that program. So that's the fees that you will be investing to do the clinical degree. Second is, will they allow you to work in Australia after that? Unfortunately, no. So even if you do the declined to enter the program, as they were saying, part 1, what they're saying is to work in Australia, after 3 years of studying, you need to pass the part 2, the practical exam. So again, it brings you back in the same boat that ADC is not leaving you alone. So even if you do a specialization to work as a dentist, you still need to pass the part 1 and part 2. The benefit of doing this kind of program is that you'll be working in the system for 3 years, so you're a lot more comfortable than other people who haven't worked in the system. And you'll be working, you'll be treating patients, you get the temporary license till that time in that university, not in the private practices. So is there any other way apart from ADC? Yes, there is, but again, it limits you to do what you can without the ADC. So ADC is not going to leave you alone. So you'll have to go through the Australian Dental Council exam. The third question is that easy to get a job like dental assistant or dental hygienist until we clear the ADC exam? What must be the least pay for dental assistant or hygienist? Now, when you talk about clinical in which you are actually treating patients, dental assistant, you're not treating patients, you're assisting, right? Yes, there are certain duties of assistant that, taking impressions and helping with other stuff that if a dentist allows you, you may be able to do it under supervision. But you can't technically treat patients without supervision, like doing cleans, doing simple occlusal fillings and stuff, which hygienist and oral health therapist can do. Then with oral health therapists, they have a bit wider scope that they can do some other fillings as well. But the problem is that you haven't done any clinical studies, right? So clinical, even doing hygienist, you cannot. So the thing there is that you cannot work as a hygienist until you have done a hygienist course of 3 years, which is in Australia, or oral health therapy course in 3 years in Australia. Okay? If you're an overseas hygienist, you again have to do the ADC hygienist course or the exams, the ADC exams, which is for the hygienist, but without that you can't. Any of the clinical thing that you're touching the patient, you can't do it. Simple as that. As far as getting a job as a dental assistant, I always tell everyone nothing is easy. Nothing is, you can't say that, this is easy, this is difficult. Everything is difficult, but yes, I have seen a lot of dentists always need a dental assistant, a good dental assistant with good communication skills, with good background, good knowledge of dentistry, someone presentable, someone who's really friendly, has good communication skills, can, calm the patients down, make them feel really relaxed and have a nice personality that actually lifts the motivation of the clinic. Everybody wants that. So if you have some sort of personality, and even if you don't have these traits, you are really willing, someone who's really willing and really want to work, you go and try and apply for places. I'll make a new video exactly on how to apply to be a dental assistant and completely on dental assistant, how to be a dental assistant in Australia for you all who are interested. I'll do that for you, so it'll be a bit more detailed on that specifically. But yeah, it's not easy, but a lot of jobs still available. If you try, do a lot of things, you'll know a lot of people who are already working as a DA. You don't need any specific qualification for that to be a DA. You can, because you're already a dentist, right? So you can just go in and you can work if somebody hires you. Pay-wise, it depends from person to person, depends on your age as well. Now, because we are dentists, we have a limit pay of, I think, $22. You can't pay less than that because of our age as well. If you're over 24 or something, that's something, again, you can double check. But roughly looking at from $22 to $28, roughly. Now, depends on clinic, depends on your work. Initially, it'd be something like that. After that, they may increase you from, something else. So they can be different. But roughly looking at from $20 to $30 average should be your salary. Then after that, if you become a senior assistant or coordinator, they may increase it to 35, even 40. Depends on the work you do, depends on the hour you do. When you work on Saturday and Sundays, you get hour and a half rate on Saturdays. On Sundays and public holidays, you get double of your pay. So there's certain things you can always do to earn more money. But yeah, for dental assistant, it's pretty much like that. You don't need any extra qualification, but you can get that one. I'm currently, the next question is from one of the people from India, and they're saying is, I'm currently staying outside of Australia. What visa should I apply for giving part 2? Now, with all that COVID situation happening, we all know it's a very tricky situation. This is very hard. A lot of deaths, and Australia is really scared right now because its COVID rate is a lot less compared to other countries. So Australia is not taking any chances. As far as I'm concerned, this is an immigration issue, not giving visas and stuff. So this becomes really tricky. So it's really hard for me to say which visa you can apply. But at the moment, what I'm aware of is they're not giving any visas for you to come until COVID really settles. So they're saying at the moment 2022. Previously they were saying 2023, even 2024. Now they're saying 2022. If there are higher COVID cases again, like the third flow or third wave, they may decrease it again. But I know it's a very, very difficult situation for people who have passed the exams and, they are waiting for their part 2 dates. They passed their part 1s and they are ready, they are prepared, but they're overseas and life is testing them. But unfortunately with visas, it's an immigration issue. So we can't do anything until Australia or the Prime Minister, they allows it, to be honest. Okay, this question is, my name is this, and I'm a big fan. Thank you for that. I'm in an equivalency process and I'm past the two theoretical exams. And then, okay, so this person is from Canada. What she's saying with the new pattern of Canada, because if you're overseas, I think Canada has something like an equivalency exam, like ADC exams, like US has the national boards, which is now the integrated board exams like INDB. So she's saying that they're saying that we have changed the pattern of the clinical exams, like similar to the ADC exams now, the OSCE. So can you please guide us with the OSCE? Now, again, it's a very wide topic. When you talk about how the OSCE works and how the communication task works and how many setup you have and how many stations you have to go through and how to study OSCE and communication, it's a very wide topic. I need 3 hours to tell you everything in detail. So maybe I'll talk about this in another video, that how to do communication and OSCE task and what is included in that. But yes, with Australia, they added that previously. Previously, we didn't have OSCEs and communication as well. But the problem why they're adding it is, and I've tested that in my real life as well, that if you have great skills and you are a great dentist, that's amazing, but you need to know the communication. You need to be able to communicate with your patients. If you're from overseas and you lack and not completely confident in English and your patient is not comfortable around you, no matter how much communications, like how much skills level you have and how much good implants or extraction you do, it doesn't come to use. Well, that's why they're doing the communication and sort of like the hands-on stations as well, so they be able to demonstrate your communication ability when patient comes in difficult scenario like angry patient protocol. And if a patient comes with pain and asking for a medication, or if a kid with a trauma or with a lot of decay in the mouth, or someone who has pain in the mouth, he's not want to get a root canal but we want to get the tooth ripped off. How will you communicate with them? What would be your communication strategy? So there's one examiner who's sitting and marking you, the other one acts like a patient and you actually communicate with them. So they want to test these skills because they feel these skills are very important, and I can't agree more. These are also very, very important skills that a clinician should know. Just be able to do a good root canal and not be able to communicate doesn't just do half the job. So that's what they're basically trying to do. And maybe I'll talk about how this OSCE and communication works in a separate video completely. The third question is, I'm from Brazil and I'm doing the initial assessment and written exam offshore and planning to come to Australia only for the practical exam. So they're saying is that I'm from overseas, and a lot of people do that, is I don't want to come and live in Australia because it's expensive or visa issues or whatever. I just want to come and give the exam and go back. So if I fail in the first attempt, how long after I could repeat the exam? Now, when it comes to the practical exam, obviously there are dates that, you have to suit the availability of the exam. That's number one. Second, there's a list. Like people whose exams are expiring, they give them the first opportunity to give the exams. You already have like 3 years until your exam expires and you have time. So if you have given the exam and you fail, you can, we have to wait a bit until the next person basically gets the turn, who have been waiting from a while, and then you get the second turn. With the new format, they have ADC, you have a lot of dates available, and because overseas people are not coming, so it's not a problem. However, this is the practical. This person is asking for a theory, like if I give the theory exam, how long do I have to wait and stuff? For theory, it happens every 6 months. So it happens in March and it happens in September, as I'm aware of, twice a year. So if you fail in March, suppose if someone fails in March, they can sit again in September. And if someone fails in September, they can sit again in March. So it's basically 6 months that if you fail, you can give it again. And you can give it as many times as you want to. There's not a like a hard rule that, only 3 attempts or something. No, nothing like that. So once you have done the part 1, you passed, amazing. If you don't by any chance, and nothing to be disheartened, everybody fails. Everybody has failed a lot, I suppose. And we all have experienced a lot in life. 6 more months and you give the exam again. So September and March. So you can repeat the exam as many times as you want. The practical exam, as I said, now it's not any set dates like every 6 months. There's so many dates available because you have one center. It happens like 2 exams or 3 exams every week. So lots of dates available until Melbourne gets in lockdown, which is a bit tricky. But overall, lots of data available for the practical. You don't need to worry. But for theory, you have to wait 6 months. The second one is, let me just open that one. So this lady is from, this girl is from Pakistan. And what she's asking is, a lot of people come and do the Masters in Public Health program. What are the benefits of doing this program? If I do Masters in Public Health, will it benefit me with doing ADC in the future, or getting a job as a dentist, or any benefits of, in Australia, other jobs related to that? Now, let me tell you, very honest opinion, why a lot of people do public health. What I've seen. A lot of people do the masters in public health because when we talk about other fields, like when people are from marketing and BBA and the other field, they have a lot of options available, wide spectrum of range they can do their masters and further postgraduate studies in. When we talk about being dentist and our clinical masters, like 200,000 for 3 years, which we can't afford. A lot of people, I'm very sure they can't afford it, which is very costly, and that's just the tuition fees. Then your living cost, then you have to pay for, food and stuff as well, your daily routine and stuff. So the cost goes really high. The reason why people do public health is it's under $50,000, the tuition fees, which is, again, I wouldn't say it's that expensive, but it's for the 2-3 years period. It's at least in that range where you can earn a bit of money, give it away. So you can, even if you arrange half the fees, that you can manage to come to Australia. The benefit of doing masters in public health or any other postgrad, which comes in your budget, is it gives you that time frame to come and live in Australia.